So, a very good afternoon to all. We have Dr. Bansari with us, who is a dermatologist. Welcome, ma'am, with us today. Thank you so much for giving us your time.
Thank you for having me.
So, one second. Yep. So, what do you enjoy most about being a dermatologist, and what made you choose? What made you want to choose dermatology?
Dermatology was always my passion. I was fascinated with all kinds of diseases that people have in dermat, and there is no resolution to it. Like so many diseases are like that they keep on coming back. So I wanted to be in the field and see what I can do to make something out of it. And people think that it's just dermatology is just any line, but it's not actually. The diseases like acne, psoriasis, eczema, everything affect psychology of people so much. They the value of they put into themselves, they feel so bad, depressed. There is lots of things associated with this branch. So I was always interested in taking up dermatology and helping people.
Even I had this, I had like a couple of days back the the what I can call the acne here. Even I was in the same bad state, but now it's
Yeah,
gone.
people feel all conscious, and they feel unsocial. They don't want to go out. They feel anxious. They feel conscious about how they look. So it affects the psyche of a person a lot,
Yeah,
because
true.
I have myself undergone it when I was a teenager, and I had a lot of acne issues. My brother, my family, so many members have undergone through it. So it's a very complicated process.
I understand. So, being into a noble profession, there surely comes a lot of respect. But if you weren't a doctor, then what would you be and why?
If I wasn't a doctor, what would I have been? I have never actually thought about it, because since I was a kid, I wanted to be a doctor. I don't know how, but it has been like that. Since I was a kid, my family, my grandmother especially, it was her dream to see me as a doctor. So she has always told, you'll be a doctor, you'll be a doctor. And I don't know, but I also, it was not like it was forced upon on me or it was expected of me, but as a child, I wanted to be a doctor, to help people and to do, make something of myself. So it has always been a doctor.
So, being into a medical field, doctors saw the most difficult 2 years. How did you cope with the same professionally and personally?
So I was doing my residency during the COVID time. I was still a postgraduate during that time. So it was a very difficult time for many people. Everyone was just stagnant. Everything was just stagnant. So many people suffered from so many issues. Other than COVID, there came out so many issues. So what we did was we were just going to our OPDs like usual and trying to help out as many people as we can. So whoever will come to OPD, we will treat them. Personally, we were all going through phases of life, all stagnant, all worried what is going on, and thinking, percolating, anxious, and it was a phase of life where, thank God, we have come out of it.
The 2 years was a lot of the 2 years has come with a lot of ups and downs in
Yeah, they were.
everybody's life. So, in today's atmosphere and weather, how one can protect their skin and hair in the best possible way?
How they can protect their skin and hair in the best possible way. The first thing any dermatologist worth their salt will tell you is use sunscreen for skin. Must. Any season, be it rain, wind, shine, any season. sunscreen is a must to protect your skin. It can lead to n number of things: hyperpigmentation, fine lines, wrinkles, signs of aging, skin cancer, anything. So what you need to first do is do sunscreen. Second is moisturize. You can protect your skin by, you can protect your skin barrier by moisturizing regularly. And it is a myth that oily skin people should not use or should not use moisturizer. Every skin type needs moisturizer. If you're oily skin person, you should use a lightweight moisturizer which is non-comedogenic and oil free. And other people can use normal moisturizers rich in ceramides, squalene, everything. So the two things I'll tell you to protect your skin: moisturize and sunscreen. And for hair, you just need to take routine care of your hair. You need to keep on washing your hair regularly to get rid of all build up oil and impurities. You need to use a conditioner after every wash because it's important to nourish our hair also. We can use a hair mask once a week and a hair serum regularly. This is what gives you a solid good hair foundation. And you should take your supplements or your normal food vitamins. You should include green leafy vegetables, you should include citrus fruits, you should include nuts, omega-3 fatty acids in your diet, and protein. All these are must to protect your skin and hair regularly.
And what if a person has dandruff in the hairs? So what could be the remedy to get rid of that dandruff?
What could be the remedy to get rid of dandruff? See, dandruff is a thing which will come back again and again. So what you need to do is, first, there is different kinds of dandruff. A dermatologist needs to evaluate what kind of dandruff it is, what is causing it. Is it dandruff or is it something else? And then they will decide what to give you. Generally, common dandruff is caused by a fungus called Malassezia. So we prescribe antifungal shampoos to take care of it.
Okay.
And most important thing, oiling should not be there in dandruff. So it's a very common myth where people use hair oils to get rid of dandruff, and they think it's a dry skin which is causing dandruff, so we should oil our hair and it will go away. But we as dermatologists don't recommend it. Oiling will just make the fungus worse. So that people with dandruff should not use hair oils.
Okay. So there are so many cosmetics procedures coming nowadays, and people have made it a different reality. So what is it that you want to say about being comfortable in your own skin?
So see, everyone should have a right to feel comfortable in their own skin, be however as it may. But if you want to look some way, if you want to do something for yourself, there should not be any boundaries or any limitations or any judgment on that also. If people want to get lip fillers or get nose job or get botox or anything, any procedure for themselves, they should feel comfortable doing it. No, people should not judge them. And even if you don't want to get them, then just maintain a basic skincare routine for uh, making sure your skin is well protected.
Perfect. So what are your thoughts on fillers or any other injectable cosmetic treatments?
I do support it. I don't mind. I If whoever wants to get it can get it. It's their body, it's their skin, it's their life, and they are completely safe when done under right guidance and under proper supervision and under rightful injectors who know what they're doing. So dermatologists are the best people you can go to and get your treatments done, and they're completely safe when done under guidance and under the supervision of a dermatologist.
Okay. So, being a dermatologist, what are the some kinds of challenges that you have faced in the medical career, and how did you overcome that?
Challenges we face, see, because of corona, the patients were decreased a lot. People were not coming out of the houses, like there was a lockdown obviously. So we faced that. Patient in rush was less. uh, so it hampered our education little bit then, like, during that time. Other than that, people think of dermatology as an easy branch, but it's not at all an easy branch. I think it's one of the most difficult subjects to read and to pass through. It is the lengthiest course you have ever come across, and there are every kind of specialty will be involved. Like for example, you take medicine or psychology, everything is incorporated somehow in dermatology. So we have to read extensively, and we read so much, and we inculcate so much, and then we pass our courses. So it is not an easy branch. It is one of the toughest branch out there.
So could you please tell us about your hobbies and how do you spend your time when you're not working?
Okay. I do a lot of things actually. I love to read. I read novels, mostly fiction novels, romance novels. Then I like to binge watch shows or movies or series thing on my free time. I like to go out, have dinner, have lunch. I like to shop. I like to do a lot of things. Then I like to play basketball and table tennis also whenever the time permits, but I haven't been able to play basketball in a long, long time.
Your height must be good if you play basketball.
Not really, no, that's not a requirement. I am 5'3".
But usually what I heard is the people who play basketball have their height above 5'5" or 5'6".
It's it's not necessarily that I'm good player. I just like to play.
Playing is important.
Yeah.
So lastly, here comes my last question. Could you please tell us a phase in your life that you would like to relive and a phase that you would like to delete from your life?
I would like to relieve and delete.
Yes, a phase. Like,
I would like
uh,
to relive my residency days because they were amazing. I made a lot of good friends, and I learned a lot during that time. And I would like to delete a part of that residency phase itself where it was Corona, COVID, and our 2 years went away. So both during the same time.
I mean, even the Corona phase, I want to delete from my life.
I understand. It will be the case for 99% of people, I'm sure.
Yeah. So, we are done with the interview. Thank you so much, ma'am, for giving us your time.
Thank you so much.